Hi, my name is Scott Suko. I'm the Executive Director of the Liver Coalition of San Diego, and thank you for joining us this Saturday morning for another episode of Liver Q&A brought to you by the Liver Coalition of San Diego. We have got a great speaker today, Ronni Marks, who's the founding Executive Director for the Hepatitis C Mentor and Support Group, and she's got a lot of wisdom that she's going to share. But before we get to introducing Ronni, let me thank our sponsors for our webinar series. You'll see them on the slide today. We've got Eisai, Intercept, Exelixis, AbbVie, Dynavax, and Gilead. Without their support, these webinars would not be possible. The purpose of today's webinar is for educational value only. This is not to be considered as advice from your physician or from our speaker. Rather, this is education, something to start with. So write down your questions, ask them of the speaker, or more importantly, ask your doctor during your next appointment. Before we get started, just a little bit of housekeeping. We will be doing Q&A at the end, but if you've got a question, go ahead and put it in the queue. I'll be monitoring that, and then as we get towards the end, I'll fill them with our speaker, Ronni. So at this time, I'd like to introduce Ronni Marks. Ronni, you want to turn your camera and join us on stage?
Hello.
Welcome. How are you doing, Ronni?
I'm doing well, thank you. Thank you, Scott, and thank you to the Liver Coalition of San Diego for inviting me today. Before we get started, I wanted to just go over some hepatitis C myths and see what level or how much knowledge people really have. And at the end, we'll go over the answers. So get a piece of paper and a pencil or pen and just write true or false as we go through these.
And Ronni, I remember, I'm going to go ahead and turn off my camera so it's just the full screen ahead. And I don't know if you'll keep yours on or off, but I'm going to turn my camera off.
Okay. So I'm sorry, I keep turning off the wrong thing. Wait a minute.
Perfect.
Okay,
there you go.
All right, so the first one. The treatment for hepatitis C requires an injection. True or false? I'll give everybody a couple of minutes. Seconds, actually. Children cannot get hepatitis C. True or false? You cannot be treated for hepatitis C if you use drugs. True or false? Unlike syringes, sharing pipes do not put you at risk of hepatitis C transmission. Is that true or false? Once cured, you cannot get reinfected with hepatitis C. True or false? And the last one, everyone should get tested for hepatitis C. True or false? Okay, Scott, please go to the next. Thank you. I'm going to tell you a little bit about my background so that you understand what brings me to talking about all of this today. I was diagnosed in 1996 when the internet was in its infancy. So there was very little information out there about hepatitis C. This began a very long journey for me because really very little was known at the time. Old treatments, and I have the picture of the Scream by Munich because this describes what it was like on the original interferon ribavirin treatment. I had a very aggressive doctor who prescribed my interferon injections 7 days a week. And unfortunately for me, the nurse practitioner that worked with them did not know anything about the disease because she had started the day I started treatment. It was a very, very scary time. I got every single side effect possible. It was just, the doctors didn't even know how to answer me because it was all fairly new. There were no groups at the time. I ended up doing the treatment for 10.5 months until I just got very sick and couldn't do it anymore. And years later, started my own support group, which I facilitated for 18 years, where I saw patients from the interferon era up to the DAAs and people coming in begging to get treatment. Enough with my own story. Let's talk about hepatitis A, B, and C, because a number of people do get this confused. If you do advocacy work, make sure that you have a chart similar to this. This comes from the CDC, because legislative people always are confused about it. Hepatitis A is a highly contagious and can spread from person to person through food or water. Food can be tainted when it's touched by a person with hepatitis who did not wash their hands after using the bathroom. This transfers tiny amounts of infected stool to the food. Hepatitis B can lead to serious problems such as liver damage, liver failure, and liver cancer. You can get it through contact with blood or bodily fluids of an infected person. In the US, it's most often spread through unprotected sex, but hepatitis B is not spread by hugging, sharing food, or coughing. Chronic hepatitis C, like B, can cause very serious complications, including liver failure and liver cancer. Hepatitis C is curable with treatment, whereas A and B are not, but there are vaccinations. Be sure to ask your clients if they've been vaccinated for hepatitis A and B. Next slide, please. The CDC now recommends that all adults ages 18 and up are recommended to be screened for hepatitis C, as well as all pregnant individuals should be tested at least once during every pregnancy. The testing is in two parts. The antibody test, which shows that you've been exposed to the virus, and then you must get the confirmatory test to determine if you actually have hepatitis C in your bloodstream. A lot of people get lost after the antibody test and don't go and get the confirmatory test. So if it is possible, if you can get it done in the same day, I think they're working on having them both done at the time. Now in New York City, they do automatically test. If it comes out positive, they do automatically do the confirmatory test. So make sure that your clients or friends or whomever it is that got the positive antibody test, go right away to get the confirmatory test. Next slide. Because hepatitis C is usually spread when blood from a person infected with the hepatitis C virus enters the body of someone who is not infected, one of the most common ways people become infected with hepatitis C is by sharing syringes or other equipment to prepare or inject drugs. Before 1992, hepatitis C was also spread through blood transfusions, as the blood was not tested in those days, and other procedures which involve blood components. But today, screening of the blood supply virtually eliminated this source of infection, especially in the United States. There are still countries where they are not. People can become infected with hepatitis C during such activities as sharing syringes to inject drugs. We have hormones and steroids listed, as I have been working with the transgender community and have heard from many of them how they have what they call pumping parties, where they're injecting each other, sharing needles for hormones or steroids. While there may not be blood present that they can see, it's just another risk. Tattoos and body piercings, especially in unregulated settings. Most people are very concerned about the needle used for the tattoos, but it's also just as risky if the dye has been opened and used before. So make sure when you go to get a tattoo that the dye is in a clean, unopened bottle, and that the needle, of course, is clean as well and new. And the same with body piercings. Make sure that it's a sterilized environment. Anybody that has HIV infection, 30% of people with HIV are co-infected. People that receive blood transfusions before 1992 or blood components. History of incarceration, and children born to people infected with hepatitis C. And we'll get into this a little bit more later. Sharing drug use equipment, cotton, cookers, water. Sharing pipes and straws for smoking and snorting drugs. There are people that have had occupational syringe sticks, nurses, doctors. I know of a very big doctor here in New York who actually cured themselves because as a resident, they got stuck and got hepatitis C. And then, of course, sharing personal care items such as razors, clippers, toothbrushes. It's very important that people don't share if someone has it in the house. Everyone should have their own. And then sexual transmission, while not common, there are some sexual practices that may involve blood. Hepatitis C is not spread by sharing, eating utensils, breastfeeding, hugging, kissing, holding hands, coughing or sneezing. It is not spread through sharing of food or drinking water. Next, please. Let's talk about substance use. On the right, you will see how long hepatitis C virus stays on equipment. And this is the problem people don't understand, is that even if a little minuscule of the virus is in a syringe, somewhere where you may not even see it, it will just be passed to someone else. Very important that no one shares any equipment. Everyone should have their own. This is why we must make sure that all these syringe exchange programs keep going all over the United States. I know they're trying to close some of them, and they have closed some. And it is so important that people are able to get them. People who share equipment to snort drugs with someone who's infected. The vessels in the nose, there's blood vessels, and another way. Syringes, cotton, cups, ties, razors, cookers, and straws. If you look at this, cotton filters, 24 to 48 hours. Cookers, 14 days. Syringes, 63 days. Water, the water that you use, not the water you drink, the water you use to inject, 21 days. Surfaces, 16 days. And pipes, we have unknown because hepatitis C has been found on the stems, but we're not sure it's new, that how long it can survive, as it really has not been studied. Next slide. People don't talk enough about non-injectables. We seem to be concentrated on people who inject. But just like injectables, there are non-injectables that can transmit hepatitis C. Sharing pipes is very common among those who smoke drugs, crack, crystal meth, pipe sharing. And here you have pictures of many different ways that people use pipes. Some are made by themselves, some are with aluminum foil, inhaler with foil, and some are a soda can. Pyrex tubes are another makeshift aluminum can. Depending on the pipe, it can facilitate burns and cuts on the lips and in the mouth. And the sharing of pipes will transmit and can transmit infectious disease, especially if someone has bleeding gums. Next slide. So for people that do smoke their drugs, we advise do not share the pipes, hydrate, use lip balm, and try and keep good dental hygiene to avoid the transmission from bleeding gums. It's very important to hydrate and use lip balm to avoid cracked lips and sores in the mouth that also can cause bleeding. Next slide. Can you get hepatitis C through sex? While it is rarely spread through sex, it can happen. Hepatitis C is spread during sex with an infected partner when blood is present. For example, men who have sex with men are particularly at risk of infection. Anal sex can cause tiny tears. Other times when blood is present for any reason, for example, menstrual cycle or rough sex. Sexually transmitted infections, STIs, which can cause open sores. Drug use can decrease inhibitions, leading to riskier sex practices. So it is very important that we do advise people to wear condoms when they can. Next slide. As I had said earlier, all adults 18 and over are recommended to be screened. All pregnant individuals should be tested at least once during every pregnancy. Hepatitis C among people of childbearing age and during pregnancy is on the rise as a result of the increase of drug use. Universal screening for hepatitis C is now recommended in pregnancy by the CDC, the United States Preventive Services Task Force, and lately the American College of Obstetricians and Gynecologists. Mother-to-child transmission is the most common cause of hepatitis C in children. 25 to 40% of infants clear hepatitis C by the age of 2 to 3 years old, but the rest of them are not able to be tested till they're at least 18 months of age. All children of parents living with hepatitis C should be tested and referred to specialty care as needed. Treatment is now recommended in children starting at 3 years of age, and there are studies being done of hepatitis C treatment during pregnancy. I became aware of the fact that children were slipping through the cracks as I do a lot of work in the rural areas, especially in the Appalachians. I was in a syringe exchange program a couple of days and saw so many parents bringing children with them. A lot of these people told me that they had hepatitis C, so I started to ask them, well, has your child or anyone else in the household been tested? They all told me no, they weren't. Their doctors did not prescribe that they should be. Unfortunately, there's a disconnect between where the child is born in the hospital and when the parent takes them to the pediatrician. In many states, if one admits that they are using drugs or have, the child could be possibly taken away. So this is something we need to address in our advocacy and with all doctors, that children should be screened should they come from a parent that has hepatitis C. Next, please. Challenges and stigma. I think you have to look into your own organization or your community and see how stigma looks in that community. How are people dealing with it? Are they dealing with it? Their friends and their family, the healthcare and the treatment. So many people have told me how badly they've been treated if they do go to an emergency room. And then what they deal with personally, emotionally. When I facilitated a support group, I had a woman come to me one day and tell me that her daughter would not allow her to touch her grandchildren, or when she went there for dinner, she was given paper plates and utensils. We asked her to please bring her daughter to a group, and after many times she finally did come, and we finally made her understand that these were not ways for anyone to transmit the virus. So again, the stigma of people walk around knowing they have it because of it. And I think it's something so important that we all need to talk to people. How does this affect you? How do you want to see your health? What does your health look like? And then, of course, the personal and emotional peers and support systems that they may have. I think it's so important that there's somebody that they can go to. So I encourage groups. Next slide, please. Why the silence? As I was saying, the stigma pushes people away from services, the fear of judgment, even from staffs of organizations. I think it's so important that staffs are trained around this to have empathy and make people understand that they do matter. Past experiences of disrespect, bad experiences with providers and healthcare systems. I've had a number of patients tell me that they have gone to the emergency room to have a wound cleaned or whatever it may be, and they were told, well, why should we help you? You're going to be back here in a week. It's just heartbreaking to me that people could possibly, especially those in the healthcare system, could treat people like that. And then there's the group of people that are unhoused and have a lack of insurance, and hepatitis C is just not a priority. It's probably at the bottom of their list. They don't know where they're going to get their next meal tonight or where they're going to stay. And again, the lack of understanding mental health, depression, and other comorbidities that one may be dealing with. All of this should be addressed with the people that you work with. Next slide. How to address this? Very important, having education around hepatitis C and co-infection with HIV, keeping how they can stay healthy, managing their health issues, and again, the emotional care. It's so important that you gain the trust of people and treat them honestly, respectfully, and with genuine empathy. These, in many cases, are street people. They're very savvy. They know when someone's being genuine or not. And then advocacy, great place to get patients involved, to raise awareness. Letting them know, I'm sorry if you're hearing all that, I'm in New York and there's some motorcycles going by. It's very important that you let them know that their voices matter, their stories matter. I've seen in many cases, just knowing this, how the stigma just kind of melts away. Not all of it, but a lot of it. I've had people say to me, someone really wants to hear what I have to say. So encourage people to tell their story, encourage them to get involved with advocacy. Who better to tell the story than anyone with lived experience? Next slide. As I'm talking about support systems, having a support system is encouraged. Peers, friends, family, or groups. At my organization, we have what we call the circle model. The circle model is actually a modern day support group. I had many people tell me that they did not like the connotation of support group support. It reminded them of rehab and AA. So I realized that when we do hold these groups, everyone sits in a circle. A circle has no beginning and no end. And as long as they were treated without judgment and felt that they were in a safe environment, we were able to build trust and help to restore dignity and self-worth. And most important, empowering people to be in charge of their own health. Next slide, please. Again, this is our circle model. It addresses needs without judgment. We facilitate an environment that promotes a sense of belonging where they're safe. We build trust. A lot of times in the neighborhoods, they bring in, once they trust us, they bring in their friends and they feel that they can open up. We offer support without forcing one down a specific path. We show harm reduction strategies. We have holistic approaches. The bags on, the purple bags are our patient education, counseling, hygiene kits. On them are all the risk factors of how you can get hepatitis C. And in them are self-care products, condoms, a mask now, and just products. During COVID, we were giving this out to a lot of the houseless people, and because they just had nothing. And these bags have become really educational. They open up a conversation. It gets one talking about how they've been addressing their own health. So they've really come as part of our circle. We also have an informational patient newsletter that is focused just on the patients. It's done in terms that people understand. It talks about questions to ask your provider when you go. We show people how to read their lab reports and many other things like this. We also do our services via telesupport, and we have an informational website and our blog, which has received some awards, which has been exciting. Support systems are so encouraged. Having a positive and progressive system can assist those who have been diagnosed, provide education and information on resources specific to your area, and offer emotional support to those affected and their family members and caregivers. Next slide, please. During COVID in 2020, we transitioned to supporting patients virtually through the use of digital training, webinars, and web conferences due to the restrictions here in New York. Direct response had especially affected the underserved population, as the usual avenues for services were only open in a limited capacity, if at all. While certain restrictions have lifted, we have continued to offer our virtual services along with in-person training and support that we are now starting to see sites opening up. We offer hepatitis C education with co-infection, liver health, and COVID-19 information and resources. We have virtual support groups and educational platforms, the self-care products and the hygiene kits. And we have an online training that if one takes it, the incentive is a food card online where they can get a meal. This was especially helpful for people during COVID. Next slide, please. I've always liked this comic, but it's actually out of date at this point. It's a lot longer than 25 years, but advocacy, very important we speak about it. The World Health Organization has committed to reach the overall goal to eliminate viral hepatitis by 2030. Many states are working towards elimination because there is a cure. One of the states, and you certainly can get all your information from the Liver Coalition of San Diego, because San Diego is one of the people that has, and I think Scott may be leading it actually, of the elimination. So I would get in touch with them if you feel that you would like to get involved and have your voice heard and make a difference. It really does count. Next slide. Okay. Oh, wait, I didn't want those to be, okay, it doesn't really matter. It's okay. Go to the next one. The answers are there, but that's okay. So let's put our cameras back on and let's see how everybody did. So the treatment for hepatitis C no longer requires an injection. It's as simple as 1 or 3 pills, minimal side effects, and people are begging for it. Children, unfortunately, can get hepatitis C. You can be treated for hepatitis C if you use drugs. We have many wonderful stories about people who were very diligent and adhered to their medications even while they were on drugs. So the statistics show that using drugs does not stop you from being cured. Unlike syringes, sharing pipes do not put you at risk of hepatitis C transmission. As I showed you in the chart, this is not true. We must be careful of sharing any equipment whatsoever. Once cured, you cannot get reinfected. Unfortunately, that is false. Yes, you can get reinfected, and that's why it's so important that you take those precautions. And the last one, everyone should get tested for hepatitis C. Of course, that is true. How many of you, how did you all do on this? Anybody want to tell me?
I did pretty good.
Good.
I was like, yes, because a lot of it I got from when we were talking. I was like, or I knew from different presentations.
Good. So if anybody, this concludes our training. If Scott, would you mind just going to the next slide?
Mm-hmm.
And if anybody is interested in our services, or supportive services, educational services, a circle model, please feel free to reach out to us. It's all free. We travel when COVID is not like it is right now. And I thank you so much. And anyone has questions, I'm here.
Yep, there are a couple questions, Ronnie. And the one was that you talked a little bit about like everyone should have their own equipment. And can you explain a little bit about harm reduction and what does it mean when you kind of accept that meeting people where they're at? And because it might be a different from 100% abstinence to we understand you may use, but if you are going to use, how can you reduce harm? Kind of explain how you approach that in different places across the country that might have different mindsets.
Right. And you know, the one common denominator that I see wherever I go is if you treat people with respect and no judgment, and again, as I said before, they know you're being genuine, you can really get the message over. I mean, harm reduction is to reduce the harms. And so we just try to make people understand how important it is. And many people know that, unfortunately, during COVID, because services were cut. We heard terrible stories. People were isolated and they were sharing. And I'm sure that the rates partly are up because of that. But hopefully we can start getting these messages out again, how important. We cannot force anyone down a particular path. Everyone has to choose what's right for them. But again, if you can gain trust and make people understand that we feel you're a human being, it doesn't matter what color, what gender, what sex traits you have, it doesn't matter. Everyone should be treated the same.
Excellent. And in that realm, you talked about wound care. Where does that present itself? Where is it treated, and what opportunities can there be to link people to care?
So wound care is usually because people have been injecting and they get abscesses and people living on the street. I mean, so many reasons why they have wounds. Many of the clinics do, and some of the syringe exchange programs do have wound care services, or at least kits where they will give you till you get to where the clinic you need to. They have antiseptic, you know, things that will temporarily help. But there are clinics, and the syringe exchange programs will tell you where those are, but it's important. And again, another reason people don't go to the emergency room is because how poorly they've been treated in the past.
I would imagine that there's a lot of prioritizing of needs. So someone is coming to you, maybe they're homeless, maybe they've got an open wound, it's infected, maybe they've been tested for hepatitis C, maybe they got a lot of other chronic health conditions that have not been taken care of. And then there's this emergency need of a homeless person who is suffering. How do you go about prioritizing needs, and how can treatment providers for substance use be part of that? Or is it like an integrated full service approach, or how does that work?
Not something that I deal with alone. I work, the Hepatitis C Mentor and Support Group works on site with other organizations who usually have those services. So we are the educational and supportive services part of that organization, who usually will have medical providers on staff who treat people who use drugs. You know, the one thing I have found with the providers, especially the younger generation coming out of med school, is their whole attitude is completely different. They are very open to treating people. They're very open to talking to people. So we got to hope that, you know, down the line, this is beginning to change. People are afraid of what they don't understand, and we have to educate everybody, not just the people who use, but the staffs, friends of people, to make them understand at the end of the day, these are human beings. They went through something that you probably would never even imagine.
I know that you work with groups across the country, and I feel fortunate to work with you. And I know one of them is Hep Free Hawaii, and I had the pleasure of listening to one of their advocates who had started out as a someone that utilized the services and then now actually works on staff. And she talked about the wreckage of my addiction. I thought that's so interesting. And I think the story was that she said, my health, part of the wreckage is putting everything back together. Once I'm clean and sober, it's fixing my health, untreated health. Maybe there's dental care. It's getting my credit back in line because I want to get an apartment. It's getting my driver's license back. It's getting content. It's all those things that get pushed to the side. And hepatitis C and treatment was one of those. And it just reminded me about how overwhelming it can be, and probably how hard it can be to access services if you feel judged. And where do you start?
Exactly. Again, if you can find where there's a syringe exchange or a program within organizations, if you go, I'm not trying to tout my website, but we do have, no, there are sites that you can go to. You have NVHR, which is the National Viral Hepatitis Roundtable. You have NASDAD. They all of us have resource sites where hopefully you can find services if you're somebody that really is hesitant. Many people walk around with hepatitis C for years knowing they have it, but they just don't want to go through being treated badly.
Yeah. Well, thank you. We've done a lot of webinars on hepatitis C. We've yet to have one talk about the equipment, the different types of equipment. I think some of those listening will probably find that very interesting because it's kind of glossed over, but not necessarily brought into detail. I love the chart that you showed, how long it lives on each type of equipment. So thank you so much for being with us, Ronni. Any closing thoughts? Any closing thoughts? Nope.
Not for me. Just get involved wherever you can. Be good to people and just help them. Let's get everybody cured and eliminate hepatitis C from the world.
Excellent. And we can do it. Thanks so much and enjoy your Saturday. Bye.
Bye.